Good morning. Hope everybody is feeling okay this morning and that you had fun last night. I think this is the one that residents, they're waiting for me to get back so that I can give them the secrets, but there aren't any. And my disclosure, I have no financial disclosures, but I'll tell you that I did pass FES on my first try, but at the time I was a fellow of the kingpin of FES, as I've heard him called, Jeff Marks, and I had enough fear of this test because of the research I'd read with 40% pass rates and what I had heard from other fellows and residents that I did not tell him that I had taken the test until I received my passing certificate. I'll also say that I'm flanked by experts. I'm an educator in endoscopy and I do endoscopy, but really it's my colleagues here who have done all of the research around this that I'm going to be talking about and presenting. And if you're still flying high from last night, I may have some subliminal messages, so you might be influenced. Deliberate practice. That's really the answer to how you train for and pass FES. And what this is a thought process beyond the idea that practice makes perfect. 10,000 hours of practice, blah, blah, but really 10,000 hours of imperfect practice does not help you get perfect or become an expert. And so the idea is purposeful practice, which includes these things of a specific goal, feedback, and then pushing yourself, and then taking that even further and using objective evaluation and coaching to get to deliberate practice. It's hard, it's not fun, but it's something that surgeons do in a lot of their life, and so it's something that we can use for our training for FES as well. And as part of this, the flexible endoscopy curriculum that you've heard about, the American Board of Surgery created, I think really gave us kind of a platform or a system to use for deliberate practice towards FES. The feedback part is using gauges. The coaching is the teaching that you get through the 5 years, and then the evaluation piece at the end with FES as well. So first you have to know what you're practicing for and what your goal is. The fundamentals of an endoscopic surgery exam you've heard a little bit about is the ultimate end game. There's first the web-based didactic program, which consists of 13 modules. They each have about 20 to 30 slides, and then there's self-assessment questions at the end so that you can practice and prepare. It's free, everybody can go through it, and it's recently been updated, as you just heard. The next step is this high-stakes validated multiple choice exam. Jose, I think I haven't updated. Is it 80 questions or 75? 75. Yeah, okay, 75 questions. You have 2 hours to take it, and it covers the topics that you can see here. It is probably the best written, most validated exam of any exam you're gonna take in your surgical education. There's a lot of effort been put into this, and we've recently rewritten it and done a lot of updating to that as well. And then if you get past that, the next step is your validated hands-on test. So it's not a test of endoscopy. I think that's the first thing that throws people off. Oh, I can do a colonoscopy in 12 minutes and I'm so fast, but I can't pass this test. But what it's really testing you on is these deconstructed skills. There's 5 unique skills. You're not doing a colonoscopy, you're not doing an EGD. It's tested on the 3D system, but you don't have to practice on that one. You can practice in clinical experience, or you can use any training system. And the 5 skills are, as you can see here, navigation, loop reduction, which is the most difficult for people, retroflexion, targeting, and mucosal evaluation. As you're taking the test, it helps to know that in the first 4, you have a time, point where you'll lose your prior tasks. You have to get through that and then keep moving forward. You can't go back. But in the mucosal evaluation, you can go back and forth and keep looking for things throughout. So tips for passing the hands-on test: listen to your instructions and prompts. No, you might want to just practice once on the simulator so that you're used to not having suction, insufflation, or wash, or haptic feedback. And then remember that the modules aren't meant to mimic an endoscopy, but they're testing a specific skill. And then it's an average, so you can do really well on a couple and not so well on 1 or 2 and still pass. We also don't let you practice on the FES testing modules, but that doesn't mean we don't want you to know what they are or how they work. And so you can find videos that Dr. Marks and others have put together that will actually take you through all 5, show you videos of them, and really talk you through the process. We want you to be prepared for the exam, but we don't want you to practice for it. We want, again, it's promoting safe and competent endoscopy. So what we've seen in research is that clinical experience matters, and that if you scope often and follow a prescribed curriculum, you can pass this exam. The higher clinical experience you have, the higher likelihood you have of passing. There are some other things involved with this that I assume Dr. Ritter is going to talk about in his next talk. But more endoscopy is the answer. And then doing it with coaching and with evaluation and feedback is really the next part of that. The gauges scores have correlated very well to passing. If I remember right, it's a score of 15 or higher is basically 100% predictive of passing your FES manual skill test. So it's an important part of FEC that translates to FES. And as we also just heard, practicing on a simulator is not required, but it can be helpful. It can help push through learning curves and help with skill development. This is that same recent research that has shown that self-reported simulator time doesn't predict passing, but what did was increase in clinical experience, and as you went up, your odds of passing was quite significantly higher, that no other variables really explained it, and that even in those people who had the lower clinical numbers, more time on the simulator did not increase their passing rate either. You can use any number of simulator. It doesn't have to be the GI Mentor or the simulator that the test is done on. There's been a lot of, quite a few validated, handmade, or other commercial simulators that have been studied very strongly, that going along with a proficiency-based curriculum can really lead to very high passing rates, up to 100% in many of the programs. So deliberate practice is the answer for how you pass this test. Study the didactics, take that test, follow a structured clinical curriculum. You use simulation if you want to, or if you feel like that will help you, but pick a pathway, and don't have unstructured simulation time is not helpful. Do more endoscopy, do it with someone who gives you feedback and coaching, and then when you get to the exam, don't overthink it, listen, complete the tasks, and move on. That's it. Thank you.